Next up, we have Assemblymember Arambula presenting AB 1344.
Thank you, Madam Chair and members. Syringe exchange programs have been essential in reducing HIV, hepatitis C, and other infectious diseases in California for decades. AB 1344 will protect these vital services by providing these programs an exemption from CEQA requirements. We have experienced a rise in drug-related harms, including overdose deaths, hepatitis C diagnosis rates, and increased rates of potential HIV transmission in California and the rest of the United States. Access to sterile syringes reduces HIV and viral hepatitis infections while being safe, effective, and cost-saving. California syringe exchange programs provide a wide range of services in addition to syringe access and disposal, including HIV and hepatitis testing, overdose prevention training, and referrals to drug treatment, housing, and mental health services. These services have helped to garner the trust in people who would not otherwise seek out harm reduction services. But recently, unexpected legal challenges have arisen. Despite the clear language of the statute that this section is to operate notwithstanding any other law, one court in Orange County has interpreted syringe exchange programs as projects subject to the California Environmental Quality Act because the program could not demonstrate that it collected all the syringes that it distributed. Subsequently, the program was forced to shut down. Another program in Butte County has been forced to rescind its CDPH approved application in the face of similar litigation. Additionally, a similar lawsuit has been filed against a syringe exchange program in Santa Cruz in early 2021. We must be reminded that there is an urgent need to expand syringe exchange programs in our state in order to address our looming opioid public health emergency. During the pandemic, there has been a sharp increase in overdose deaths as evidenced by the CDC. The need for access to syringes and other services provided by syringe exchange programs is now greater than ever. These types of suits are an example of how requiring CEQA review of public health programs improperly places disease prevention and environmental protection at odds. Without immediate legislative action, the public health prevention services provided by these syringe exchange programs directly authorized by the California Department of Public Health will be curtailed, and new programs will be deterred at the precise time when the need for them is increasing. AB 1344 will help protect Californians from the rapid spread of HIV, hepatitis, or any other potentially deadly or disabling infections that are spread through the sharing of used needles and syringes by protecting these valuable community-based syringe exchange programs. I'm joined today by witness Mary Ciala, Senior Staff Attorney at the Drug Policy Alliance, and Dr. Peter Davidson, a UC San Diego Associate Professor of Infectious Disease and Global Public Health.
Thank you. Moderator, can you please open the phone lines for our witnesses? We'll start with Mary Ciala.
Hi, thank you. Can you hear me?
Yes, and I just want to remind you that you have 2 minutes to provide your testimony.
Yes, thank you. Good morning, committee members. My name is Mary Ciala, and I'm a Senior Staff Attorney at the Drug Policy Alliance. I'm here today in support of AB 1344 on behalf of the co-sponsors of the bill, the Drug Policy Alliance, the National Harm Reduction Coalition, and the San Francisco AIDS Foundation. We've come together to sponsor this bill to protect syringe services programs, which are fundamental to disease and overdose prevention in California. Requiring CEQA review of public health projects such as these unnecessarily places disease prevention and environmental protection at odds. We urge you to protect the integrity of CEQA and stop its misuse to attack public health programs by passing AB 1344 out of this committee. I'm happy to answer any questions the committee members may have about the legal or public health circumstances that necessitate this bill. Thank you.
Thank you. Next witness, please.
Good morning. I'm Dr. Davidson. I'm an associate professor in the Department of Medicine at the University of California, San Diego. I've been conducting public health research on harms associated with drugs for almost 25 years, originally in Australia and since 2000 here in California. Needle exchange was a controversial idea when it was first proposed as a public health response to HIV back in the 80s. And so in the decades since, we've conducted an enormous amount of research to test whether it's achieved its intended aims and to ensure that it wasn't producing unintended negative consequences for the broader community. Because of all this research, we now know that needle exchange does reduce HIV, hepatitis C, and other bloodborne viruses. We know that people who use drugs who have access to needle exchange enter drug treatment sooner than people who don't have access to needle exchange and have shorter drug-using careers. We know that law enforcement in communities with needle exchange have lower rates of needle stick injuries. We know that needle exchanges are the most effective way to distribute naloxone to people who use drugs, and that doing so is associated with reductions in overdose deaths. Of particular relevance to this committee is the extensive research conducted to see whether needle exchange is associated with increases in street discarded needles. We now have decades of research which has been done here in California, across the United States, and around the world, which consistently shows that needle exchange is statistically associated with reductions in street discarded needles, not increases. Needle exchange is part of the solution to street discarded needles, not part of the problem. To give a single recent example from the literature, a 2011 study comparing Miami and Florida, which did not have needle exchange, with San Francisco here in California, which has comprehensive needle exchange, found that there were 8 times the number of street discarded needles per 1,000 census blocks in Miami compared to San Francisco. When people who use drugs do not have access to needle exchange, they reuse and share needles more often, and when they discard them, they do so improperly.
Sir,
in the study I just mentioned,
please wrap up. 30 seconds, please.
Thank you.
To wrap up.
In the study I just mentioned, 95% of people who use drugs in Miami where there were no needle exchanges reported discarding the last needle they'd used on the street, a rate 34 times higher than in San Francisco. Decades of evidence shows that needle exchanges are an effective way to reduce street discarded needles. They have no negative impact on the environment, and the legislature should support streamlining the process of their authorization, especially in the light of the worst drug overdose crisis in our state's history. Thank you.
Thank you, sir. Next, we have 2 witnesses in opposition. I have Todd Kimmelshoe, Butte County Supervisor, and Robert Berry from Rob Berry Law.
This is Todd Kimmelshoe. Can you hear me?
Yes, please go ahead.
Okay, thank you very much. Good morning, Chair and members of the committee. I would like to refer you to a letter from Butte County as of March 23rd, 2021. Butte County opposes Assembly Bill 1344, which seeks to exempt California Department of Public Health authorized syringe exchange programs from the California Environmental Quality Act, CEQA. CEQA is one of the only tools that citizens have to seek from environmental harm, and it's important that the CDPH recognize this harm. Once the syringe is used to inject illicit drugs, it has immediately become prohibited paraphernalia. Knowing this, many users immediately discard their syringes after their use. This is especially true where the supply of new syringes is unlimited and free. Needle litter is an unavoidable consequence of loosely regulated drug paraphernalia distribution programs, especially those which have no requirement for exchange used needles for clean ones. While CDPH seeks to exempt themselves from the consequences, the danger to the public remains. Families with young children must now worry about the dangers of potential needle sticks when visiting playgrounds, parks, and waterways. One of the most solemn obligations of government at every level is to protect the health and safety of its citizens and to ensure the environment remains pristine and litter-free as possible. AB 1344, we believe, is unwise and contrary to the widely held tradition of putting environmental protection at the forefront of wise public policy. For those reasons, Butte County urges you to vote no on Assembly Bill 1344. And again, just to reiterate, discarded needles are an environmental hazard. When needles and syringes are freely distributed and easy to obtain, they are freely discarded. Those items, needles and syringes, end up in parks, waterways, playgrounds, and our streets. Working through the CEQA process. Yes, I will. Thank you. Working through the CEQA process for anyone who wants to distribute needles is our only protection. Thank you very much for allowing me to participate today.
Thank you. Next witness.
My name is Rob Berry, and I'm one of the attorneys that brought the lawsuit in Butte County that was referred to earlier. The intended purpose of the important CEQA legislation is to facilitate informed land use decisions by identifying, analyzing, and mitigating detrimental impacts of projects on the environment. When a state agency can ignore CEQA entirely, as was the case in Chico, the community suffers irreparable harm to the environment and their safety. As a result of this disregard for the interests of the general public, communities react strongly against these programs, as did the Chico citizens. Instead of working with communities to mitigate their concerns, the state proceeded unmoved by public sentiment. In response, our citizens sued, and in settlement, the Department of Public Health reluctantly agreed to withdraw their program approval and, in a binding settlement agreement, conceded they must comply with CEQA for all and any programs approved in the future. Even with that promise, every city and township in Butte County has now enacted local ordinances which ban such programs outright by using their land use powers to disallow that use and to declare such programs a public nuisance. Such a strong reaction from citizens is a reflective of the harm that they suffered. Rather than work with communities to mitigate environmental harms as required under CEQA, they now seek to permanently overpower the will of local jurisdictions by pursuing exemptions for themselves for the very laws this legislature has passed to protect the environment now and for future generations. The only way to establish sustainable syringe exchange programs in local communities is to ensure that such programs and the agencies which approve them remain accountable to local governments and the public for present and potential future environmental harms. This is completely consistent with the fundamental purpose of CEQA. And for these reasons and more, we oppose this amendment entirely. Thank you very much.
Thank you. Next, we will take witnesses in support or opposition on the phone lines. Please just state your name, affiliation, and position on the bill. We are accepting additional testimony of any length via our committee website at antr.assembly.ca.gov, and we will have the phone lines open for up to 5 minutes. Moderator, can you please open the lines?
Yes, thank you, Madam Chair. If you would like to speak in opposition or support, please press 1, then 0. We'll start with line 98. Please go ahead. Line 98, your line is open. No response. The next line is 75. Please go ahead.
Thank you, Madam Chair. Tim Madden, representing the California chapter of the American College of Emergency Physicians, in support.
One moment, please. Line 117, please go ahead.
Madam Chair, members of the committee, Robert Harris on behalf of the California Society of Addiction Medicine in support.
Thank you. One moment. Line 101, please go ahead.
Good morning, Chair and members. Aaron Pack from the ACLU of California in support. Thank you.
There are no further lines in support or opposition. Please continue.
Thank you. Do we have any witnesses in the hearing room? Yes? Okay. Please go ahead. Please state name, affiliation, and position on the bill, sir.
Good morning. My name is Jason Lindsay, a recovering addict with 16 years clean in support.
Thank you. Any witnesses in the video conferencing? Okay, I see none. Any questions from members of the committee? Mr. Stone.
Thank you. Mr. Arambula, we've chatted about this. It's although part of me should be heartened with the support we're hearing for CEQA, the problem is what the underlying analysis really is the project. And I have not supported CEQA exemptions. I've talked to my local advocates about this. I'm not going to support the CEQA exemption here either, because to me it's not about the underlying project. It's about undermining the law that we have put in place. And I think there are other ways for facilitating needle exchange programs in our communities, which are very, very important. I completely agree with you on that. So I'm sorry, but I'm not supporting it today, but that's why.
Mr. Wood.
Thank you, Dr. Arambula. I know we've talked about this a lot. I'm a big supporter of CEQA as well, but I do take offense that CEQA is being used to undermine projects like this. I think that are important. I will note that League of Cities removed their opposition, RCRC removed their opposition. I just think that there are times when cities are doing this to essentially eliminate needle exchange programs, and I think that's wrong. So I thank you for bringing the bill forward.
Thank you. Mr. McCarty.
Yeah, thank you. At first, I walked in, I saw Dr. Wood. I thought, are we at the health committee again? Because this is a health topic. I know we've talked about this in prior health committee. And look, in Sacramento, I remember we established one of these. It was very controversial, and it's been worked out for public health. But across the street, literally in the county, they won't adopt a needle exchange. And it's not because of CEQA. It's because of their conservative politics. So I apologize to the chair. I missed the first few minutes of this presentation. Did you give examples of jurisdictions that denied a needle exchange facility, and we could point that CEQA was the issue?
We had mentioned earlier that currently Orange County had brought a lawsuit for CEQA. We had mentioned as well about Butte County and how Santa Cruz has a lawsuit which began in early 2021.
So in those jurisdictions, the city or the county approved a needle exchange facility, and it was blocked because of a CEQA lawsuit?
In those jurisdictions, the California Department of Public Health had approved a syringe exchange program, and those local municipalities weaponized CEQA. And also had, if I could, added a layer regarding nuisance. Earlier, we'd heard from the Butte County Board of Supervisors regarding their March 23rd letter, but it did not comment on the amendments that we took on April 8th within committee that bifurcated this bill and allowed for the nuisance provisions to continue. And thus, we heard their testimony state that it was the only tool that was available. And in reality, I believe they still have litigation and opportunities to pursue what the locals are seeking right now.
Okay, thank you.
Mr. Chow?
Just a follow-up question to Mr. McCarthy's line of questioning. The program has been around for so long. Are we just seeing these lawsuits in the last couple of years?
That's correct.
All right. Thanks.
Okay, hold on. Any other questions from the committee? No. Oh. That's it? Okay. Would you like to close, Mr. Arambula?
Thank you, Madam Chair. I respectfully ask for an aye vote.
Okay. The motion is due pass to appropriations. We have a motion from Mr. Woods, seconded by Mr. McCarty. Secretary, please call the roll.
Item 2, AB 1344 by Member Arambula. Members Rivas?
Aye.
Rivas, aye. Flora? No. Flora, no. Chow? Chow, aye. Friedman? Garcia? Mathis? No. Mathis, no. McCarty?
Aye.
McCarty, aye. Maratsuchi? Sayarto? Stone? No. Stone, no. Wood? Aye. Wood, aye. 4-3.
4-3. We'll leave that open. Thank you, Mr. Arambula.
Thank you, Madam Chair.